I was born in Atlanta, Georgia, and moved to Macon with my family 3 years of age in 1977. My dad practiced medicine here. He was an OB/GYN, and so we moved to town. And I spent, from age 3 to age 18 growing up in Macon. And so, it's from my earliest memories, Macon's my hometown, and certainly a lot of fond memories. Also, shortly after we moved here, I was diagnosed with a pediatric orthopedic condition in my hip, and so I was in and out of orthopedic offices for the better part of about 3 or 4 years. And so it was always something that intrigued me, that in conjunction with my dad's job as an OB/GYN, certainly. As I got older in school, I was more intrigued by the sciences, and it just seemed natural. Left here in 1993, graduated from Stratford Academy, and then went on to the University of Georgia for 4 years. Majored in cellular biology and pre-med, and then on to the Medical College of Georgia for 4 more years. Graduated from Medical College of Georgia in 2001, and spent the next 5 years out in Memphis, Tennessee, studying orthopedics at the Campbell Clinic. And when it was time to decide where to go, my wife, who I met at the University of Georgia, is also from Georgia, South Georgia, and we started looking around the Southeast, and we kind of, as our backdrop, Macon was what we compared everything to. At that time, Macon had several orthopedic practices, and I had a mentor at one of them, and we couldn't find a place that exceeded what Macon had to offer with regards to community, family, and quality of orthopedic care. Well, in 2006, my wife and 2 children moved back from Memphis to Macon, and we joined Precise Street Orthopedics, and I practiced there for 8 years until 2014, when our group at Precise Street merged with the group on Northside Drive, OrthoGeorgia, to become one big group, OrthoGeorgia. And we still had 2 facilities at that time, one downtown, and then one out here on Northside Drive. And just recently, in the past 6 months, we've moved from our facility downtown on Precise Street out here, and now we have all our spine physicians along with some of our other physicians, including myself, in the new spine and orthopedic building on Northside. I think it's a wonderful place to practice medicine. It's certainly an upgrade from our old facility. It's a beautiful building. It's extremely functional. Patients have had nothing but nice things to say, and so I've seen a group of patients kind of follow me from downtown out here, and they certainly do enjoy their experience out here. I do a little bit of pediatrics. I take care of pediatric trauma, so broken bones. I see children of kind of all ages. Saw a 2-year-old today. And so I do general orthopedics now, so I see young and old, trauma and degenerative conditions. I take care of, again, patients of all ages, the pediatric trauma patient to the, elderly 90-year-old with a degenerative condition. So it ranges from operating on, and again, I see folks with all sorts of ailments, but from a surgical standpoint, I take care of shoulder problems, whether it be traumatic fractures or degenerative conditions and rotator cuff problems. We have 5 hand orthopedists here, and so they do the vast majority of hand and elbow surgery. I do hip and knee replacement. I do knee ligament reconstruction. I do foot and ankle deformity correction and trauma fracture care. So certainly, I would think in my practice that 10 to 15% of folks that I see actually get surgery. The vast majority of the things we do, we can handle without surgery, whether it be physical therapy, anti-inflammatory medicine, bracing, sometimes an occasional injection. And there's new things developing on the horizon, it seems like on a monthly, but certainly on a yearly basis, trying to improve what we do, trying to limit exposure to surgery. There's a whole side of medicine talking about regenerative medicine, and I do some of that as well. And I think, to some degree of success, have been able to avoid surgery in some cases, or certainly delay it. But ultimately, an arthritic knee, when the non-surgical options fail, is going to be best treated with a knee replacement, and the same with a hip. And when a knee is unstable and has a ligament that's failed, the ligament needs to be fixed. And so, we certainly can take you down the road of conservative care, but sometimes when that fails, surgery is your best option. Yeah, it's a wonderful building. Along with our main building out here, both of them have ASCs, and so we're real proud of both facilities, and real proud of what we're putting out there in the community with regards to the quality of care and the specialties we deliver. And I personally would put the orthopedic care that one would receive here on this Northside Drive campus up against any care one receives around the state of Georgia or even the Southeast.